Good afternoon. I'm John Horowitz, President and CEO of Easterseals, DC, Maryland, and Virginia. As part of our organization's pandemic response, we continue to host Candid conversations, webinars to share vital information and discuss pressing issues impacting our community. Previous sessions can be seen on our YouTube channel and include topics such as talking to our children about racism, the impact of the Americans with Disabilities Act, and virtual learning, to name a few. These areas are central to the mission of Easterseals and connect to the direct care services we provide. Today, you have joined us to address the national mental health crisis in the age of COVID. This topic is timely not only since September is National Suicide Prevention Awareness Month, but also because suicide impacts every individual in the world. Particularly in these challenging times with COVID and painful situations in the news, mental health struggles do not discriminate. They are not deterred by economic status, geographic location, race, gender, religion, sexuality, ability, or age. Therefore, it is imperative that we destigmatize seeking help and normalize conversations regarding the resources available for self-care and wellness. By participating in today's conversation, you are helping to achieve this goal. Today, we have a panel of professionals with a wide range of backgrounds to offer their expertise and situational perspective and offer recommendations to help you, your loved ones, and our community. I want to begin by introducing Easterseals' own Dr. Anika Vandenbroek, the director of the Stephen A. Cohen Military Family Clinic at Easterseals. Anika is a board-certified licensed clinical psychologist with over 20 years of experience working with military service members in the treatment of PTSD, depression, anxiety disorders, and other behavioral health disorders. Anika holds both a doctorate and Master's of Science degrees in clinical psychology from Nova Southeastern University, and she's a veteran of the United States Army Medical Service Corps. It is my pleasure to introduce her as the moderator for today's panel. Anika?
Thanks, John. I'm excited to be here and to welcome our panelists. We have Dr. Bodaghi, she's a child psychiatrist from Children's National Hospital and with the Northern Light Arcadia Hospital in Maine. And she's an associate professor with the New England School of Medicine and the George Washington University School of Medicine. She's board certified in adult, child, and adolescent psychiatry, and she's been instrumental in developing telepsychiatry throughout the state of Maine. Her treatment focus is providing evidence-based treatment to child and adolescent population via telehealth. Welcome, we're glad to have you here. We have Eric Eversole. He is Vice President of the U.S. Chamber of Commerce and President of Hiring Our Heroes. He entered military service in 1994 and was later commissioned in the U.S. Navy JAG Corps and transferred to the Navy Reserve in 2001. Currently has the rank of commander. And as a civilian attorney, he has served as a litigator in the voting section of the U.S. Department of Justice. He founded the Military Voter Protection Project to promote and protect the voting rights of active duty military members and their spouses. He serves as the vice chair of the U.S. Department of Labor Advisory Committee on the Veterans Employment Training and Employer Outreach. Welcome, glad you're here. And we have Dr. Diane Kern. She's a licensed psychologist in Maryland and DC, and she has her PhD in clinical psychology from Catholic University of America. She created the Happy and Healthy You program, and her services include facilitating workplace training on a variety of emotional and stress management issues and providing consultations for critical incidents and change management. She also provides emotional management skills and motivational training as part of workforce development programs. And she also has told us she has an upcoming book about getting back to work in the era of COVID. So we will look forward to that in a few months. And I'm going to jump in and to keep the conversation flowing, I have some general questions to start with, and I'll just call on speakers so we don't overlap in talking. Dr. Kern, maybe we'll start with you and have you jump in. Sorry, and before we do that, there is a poll that we're putting, you should see it pop up on your screen. We're interested in hearing from our participants about the effects that COVID has had on your life, about the experience of the pandemic and how maybe it's affected your behavioral health and emotional well-being. And we'll share the results of this poll in, later in the presentation. So if you can take a moment or two to fill that out before we jump into the conversation. So, Dr. Kern, for you, what sort of mental health concerns have you seen throughout your career, and how have they changed or been affected by recent events like the pandemic, racial injustice, other things that are happening in our world in these recent months?
Well, as a generalist and as a fairly eclectic therapist, I've worked with a wide range of issues throughout my career. What I've seen, though, is an exacerbation of anxiety and stress, certainly as a result of this very traumatic, and I think I can't emphasize that enough, this very traumatic pandemic, which understandably has induced a great deal of fear, uncertainty. It came out of nowhere, and so therefore it was unpredictable. And as human beings, we have a really tough time with those types of incidents that indeed have a real threat. We've certainly seen a lot of deaths, and many of us know people, thank goodness not in my family or among my friends, but I know of people who have lost their lives, such as church members, as a result of the pandemic. And when it hits that close to home or even closer, then it is understandably very disturbing, very frightening. We're still in the midst of it. It's not over yet. And so therefore, there's a great deal of anxiety about how, when, whether we will ever get back to something looking like normal. And so as a result, a lot of us are feeling helpless in the face of this and out of control and a sense of powerlessness. And so again, having our lives disrupted in this very frightening, disturbing, unpleasant way in that regard has been a problem. Now, interestingly enough, some of my clients are doing fairly well because they have, as a result, found the silver lining. And I don't want to jump ahead too far in the program because I know we are going to be talking about coping mechanisms, but that is certainly one of the ways in which some people are doing well. So some of my clients are doing actually better than they were before because prior to COVID, they were not able to telework at all. Their workplaces wouldn't allow them to telework. And now that they are there, some of them are really enjoying that. So it's an interesting mix of effects on people.
Thank you. And is there one particular thing that you would share as a coping mechanism or a stress management tool that either works for you or have you found has been particularly helpful for your clients?
Well, I know for me personally, one of the things that has been incredibly helpful is just taking a break from, for instance, the news, putting myself on a news diet, in fact. As much as it's important to stay current and stay informed, it is also important not to become inundated and overwhelmed by those things that by the plethora of bad news from a variety of sources, this kind of constant barrage of sensationalism. And unfortunately, our news feed media in this country tends to focus on sensationalism. So basically, I do my best to watch the news maybe a couple of hours a day, and that's it, if that much. Also to disconnect, to go on vacation when I can. I just recently went on a vacation. But even when I'm not away, and of course now we can't go on vacations the way we used to. So it is important to recognize ways that we can take breaks within our own environments. I'll go out for a walk. I have found that to be incredibly relaxing, stress reducing. And so I encourage my clients to reconnect with their calm. Find whatever it is that that enables them to bring a sense of relaxation, calm, enjoyment. And so I do help them to find resources and to find behaviors and activities that they can do that are and access when they are feeling anxious and upset.
Thank you. Thank you. Yeah, that 24-hour news cycle can be a real trap for people. Eric, for you, can you speak a little bit about what things you've noticed, you know, the needs that have changed maybe in the context of recent events for the people that you work with?
Absolutely. And, you know, I think that on our end, you know, the hiring our heroes, the employment aspect of it, the chamber aspect of it, really seeing it on two fronts. One, it's those who are struggling to find employment. We know that finding meaningful careers, meaningful opportunities are so important to all Americans, and being able to find, you know, ways to connect with people. And we know that that a lot of the bad outcomes that result from poor wellness, poor mental health, are often associated with challenges finding jobs. You know, being able to take care of your family, being able to take care of yourself, being able to have a sense of purpose with your job. So, you know, from our perspective, we are certainly doing our best to help, in our case, veterans and really large populations, the American population, military spouses, find those meaningful employment opportunities. And that may mean we have to think about some industries differently than others. I think we've seen, at least recently, in the least amount of news that we can watch, because I'm definitely in agreement with Dr. Kern and everyone on that front. You know, we're in a K-shaped recovery. We know that some companies, you know, have, you know, there's been a lot of silver linings. They've been growing very quickly. Others have had, you know, dramatic impact. You know, the hospitality and retail has been negatively impacted by COVID. So we've worked pretty aggressively to help those who have lost their employment, try to find employment elsewhere or find other opportunities. For those transitioning from the military or military spouses, how do we steer them into those opportunities where there are still good economic opportunities? So we're seeing, you know, good results there. But, you know, from first and foremost, and I'll get to the point quickly, which is, you know, this is about an ounce of prevention. If we can help connect people with meaningful employment opportunities, you know, in the first instance, that's going to go a long way towards a really positive outcome. And then let's talk about it in the workplace. I mean, for those people who have not had the economic impact associated with COVID, they still have their jobs, their careers, you know, but they've moved virtually. Again, as Dr. Kern was saying, for some, that's been great. You know, they like working in a virtual world. Others, it's a lot more challenging. You know, I think that from the American business community, and I'll certainly say from the Chamber's perspective, you know, as soon as we saw the dynamic of kind of working, the workplace changing, right? We went from offices to at home. As soon as that started to change very aggressively, I think a lot of companies, most companies, if not all companies, had to start to address what was a very real challenge for many of their employees, which was all of the uncertainty that's going on in the world. Uncertainty related perhaps to their job, uncertainty related to COVID and making sure that people are healthy, uncertainty related to school, uncertainty, you know, the racial injustice challenges we're facing. There are so many things impacting America. And I tell everybody, you know, we were all dealing with rocks in a rucksack, right? And everyone has them, unfortunately. But how do we help people who who do have those rocks in their rucksack, how do we lighten their burden when it becomes too much? And for us, you know, I think the biggest thing that we did was, first and foremost, you know, try to make sure that we weren't losing anyone. Having the conversations about how people were doing in the workplace often and as frequently as possible was really the first step for us. And then thinking about, for those that need more help, that have more rocks in their rucksack, how do we get them to the right resources and the right people to make their lives a little bit better? And, you know, I think for us, you know, mental health in the workplace is always, you know, the Chamber and Hiring Our Heroes has been involved with wellness in the workplace. One of the big issues for a long time was this issue of stigma and people being afraid to ask for help. And I do think that if there is a sliver of silver lining here in the COVID challenges that we've had, is that we've seen a real acceleration of our employees' willingness to ask for help, to look at resources, to be open and honest about these conversations in a way that wasn't necessarily there 9 months ago. So I do think that there are some positive aspects of the fact that all Americans know that these resources are out there and it's okay to talk about it. And that's, in my view, a really positive step forward from a workplace environment, that we're not afraid to ask those questions, because we're all in some way dealing with rocks in our rucksack.
And could you say something about, for you personally, some things that you've done to help your coping and getting through this time?
You know, one, personally, as a leader of an organization, is to be open and honest with my staff about it. You know, we've all had those bad days, and I think that wellness in the workplace especially, but I think in all society, starts with our leaders being honest about how they're feeling themselves. And you know, I think it's really important as a leadership perspective to, you know, I've been pretty candid with my staff. Look, I just had a bad day. This has been a bad week. You know, 5 things have gone wrong. I'm sorry. But look, we're all feeling that. So I think that's the first part, which is, if you're in a leadership position or even in a community position, we have a responsibility for each other.
Yep, sounds good. Okay.
Honest about it.
All right, bye.
And then the second thing is really, I think the other aspect of you know, what we need to think about is, you know, how do we find a little bit of normalcy in this chaos? And I think I'm in the same boat as Dr. Kern. I think I've explored with my family every possible pathway along the Potomac that I could possibly find. You know, and getting out for those walks and just, you know, trying to just, you know, not have to wear a mask, be out there with your family, and just, even if it's for an hour, feel like, you know, I can let my guard down just a little bit. And I think that's really important for people, is let your guard down a little bit.
Yeah, and I think that letting your guard down in a leadership role really plays a tremendous role in reducing stigma, right? About seeking help, or about being forthcoming. That if your leadership is saying, hey, you know, I had a bad day, or oh my gosh, I can't believe how, you know, how it's been like Groundhog Day every day, that it really sets the stage for that being acceptable response, you know, acceptable feelings for the people in the organization. And
I think, Eric, what you're sharing is, you know, as a leader, it's also very important to notice what's going on with your teams. And, you know, if you notice that there's regular Zoom calls and somebody's never zooming in, you know, that can be a sign that something is amiss. And, you know, checking in with your teams is a big part of, you know, making sure that we have wellness in the workplace right now.
Yeah, John, that's a great point. I mean, I make a point of, you know, and that simple question is a big deal. I mean, asking and finding out how everybody's doing in creating a responsibility across all of your staff and all of your leaders to figure that out is really important. And for me, you know, I asked my team to put the camera on, and you know, look, we have to have this conversation. I know there's Zoom fatigue, but you know, sometimes you just need to be able to lay eyes on someone just to see how they're doing. And there's the right way to do that and the wrong way too, where you know, you could be overly intrusive, but it's really important to see people and look. You know, I often in bigger meetings, I'll try to look at people's facial expressions and try to keep track of, you know, how do they look? You know, how does it appear that they're feeling? And it's okay after the meeting. I've done this on a couple of occasions. Call them up afterward and say, you know, how are you doing? Is everything okay? And that goes so far. And oftentimes you feel like it's been a bad day. I'm okay. But it means a lot to people to take that just a couple of minutes to find out. That's a great point, John.
Thank you. Dr. Bodaghi, can you speak a little bit to the types of problems that maybe you typically see and how they've been affected by these recent events in your practice with children and with adolescents?
Hello, thank you for having me. I would like to echo the comments made by Dr. Kern and Commander Eversole that these are very, very difficult times, and our routines, our schedules, our lives have absolutely changed. And for a kiddo, I call them kiddos, and babies all the way till 18, until they can vote, they're kiddos. Their lives have just been changed, uprooted. It's the whole normalcy that they had is changed. But change could be good, and change could not be so good. The kiddos that have struggled, that I've noticed have had the most struggle, are those that have had the most anxiety, fear, worry with regards to how the current social and political climate has affected them personally with regards to their household finances, their parents having a job, not having a job, are we able to keep our home or not, families being cooped up together, and are they, and this has become a repeat sort of what I've noticed is that kiddos who have had long-standing positive relationships, open communication with their families are doing solid. They're getting by. Good social networks within the family, outside of the family, they're doing well. They're keeping up, and even this like not having to go to school is great. I'm not even exposed to the bullying, yay. But for those that don't have positive relationships within the home, open communications within the home, if there is struggles with the parental relationship together, if there's violence in the home, then the kiddo is more likely to experience significant anxiety, distress, abuse. And then my concern is, with everything in shutdown mode, for the most part, are we able to help and reach out to those people that are struggling, the kiddos who are struggling these are most these very difficult times?
Great, thank you so much. Are you seeing any like increase in cyberbullying because kids are spending more time online with education and because their social activities are now sort of restricted to online interactions?
I would have to say that part of cyberbullying, no, has not increased any more than before. But what is interesting is when I started to pick up on kiddos telling me that during the Zoom class, they had their own Zoom chat with their friends on the side and what was happening during that. And coincidentally, during those times with their friends, is when the kiddos have voiced their struggles, their stressors, their negative thoughts about themselves. And we have had a numerous amount of kiddos that have come into Children's National as a result of one of those peers reaching out to his teacher and saying, hey, we weren't supposed to be doing this, but we did. And so is saying that they're really struggling, they're depressed and having negative thoughts about themselves. And then immediately teacher, principal calls the family, and organizations such as Great as Champs gets involved to do an assessment so that the kiddo gets the help that they need. I do want to reflect on the trend as well, that currently the trend is the most sickest are the ones that are presenting. The kiddos are seeing all these things happening within their home, within their environment. And every person wants to be good and do well. Better yet, a kid just wants to just do great. A kiddo perceiving that they're gonna cause a burden on their family by how they're feeling, when dad has already lost his job, mom is really struggling to make us dinner. How could I possibly tell them that I'm having anxiety? Those kind of things, the families that are struggling the most, the kids are engaging in the very most drastic, impulsive types of acts of self-harm towards themselves. And that has been the unfortunate trend that I have realized.
How can we, or what sorts of things would parents do maybe to help their kids reach out, or what should parents be paying attention to outside of the worst of the sort of self-harming kinds of things? Like, what are the more subtle things that parents might notice or pick up on in their children as indications that they should inquire a little bit further about what's going on?
The parents are very in tune with their babies most often, especially the nurturing one is really in tune with, my baby is not smiling as much. My baby's not showing eye contact. Just like an employer would be like, turn on your Zoom, let me see that eye contact, let me see how you're looking. The kiddo's lack of self-care, poor eye contact, overall just emotional withdrawal. Those are the things that we just visually pick up on. Same thing that a pediatrician, a psychiatrist will pick up on. Number one, as soon as a person walks in, these are first 10-second things that you notice. Followed by, are they doing the things that previously made them happy and excited? If they're not doing things that are previously enjoyable activities, we call that loss of interest. So that is a big clue. But I say this whenever my friends or colleagues that don't practice psychiatry ask me, what can I do? How would I know my kiddo is struggling? I tell them that the number one predictor of how a kiddo is doing is how their parent is doing. If the parent is doing well, and coping with the stress, the parent is showing some resilience to the kiddo is going to be even more resilient, because kids are by nature that way. And if there are conflicts within the family, or if there is stress as a result of the social and political climate, having an open conversation. Yeah, this sucks, but life will. This is temporary. Life will go back to normal, and things will. And it will be great again when, like, you miss your friends, but then when you see them again, it'll be great. Reunion and such. That and I think I had one more, but I forgot it right now.
Thank you. Commander Eversole, I would ask the same, like, sort of what things maybe would leadership and an employer notice that, you mentioned the Zoom, like maybe not checking in on Zoom, but are there other things that, kind of raise a red flag for you and say, hey, this is maybe something to pay attention to?
I think first, it's a great question, and some of it's going to be a big red flag, and some of it may be a flickering yellow flag. And I think that, the big red ones, when you have people that tend to be reliable, very responsive, and all of a sudden they seemingly check out. All of a sudden, their responses to emails or communications are delayed, or they're more terse than what you're used to, or they're, you feel like you can pick up a lot on people, even in things like email, where you may see that the way that they communicate is different than what you expect, or maybe slower or delayed than what you expect. So I think part of it is, there's a saying about when you're in airports or in the metro, if you see something, say something. I think that applies to the workplace as well. If you have a sense that something just doesn't feel right, then you got to err on the side of caution. And again, there's an approach here that doesn't alarm people, where I think you can just pick up the phone and call the person, and if nothing else, just ask them how they're doing. And you'll get most of that information pretty quickly if they're having a tough day. And sometimes, that we've talked about, I mean, there's been so much change around, and some people just don't deal with change very well. And and it's okay. I tell people all the time, even if the concept, I had a conversation today where I was taking notes, and it's like Groundhog's Day. It is Groundhog's Day some of these days, and there's no doubt that that's what we're all dealing with. But I think what you have to do is there's an aspect of this that's a lot of science, picking up on the basic things where people don't act like they normally do. And some of it's just an art, where if something just doesn't quite feel right, it's better to err on the side of caution. And it's better to address those issues earlier rather than later. So to me, those are the little things that, emails, communications, Zoom. Everybody's been doing Zoom for well over 6 months now. And so even picking up patterns of different Zoom behavior, where people, it could be something as little as how they dress or how they prepare for meetings. Again, anything that to me starts to indicate that there's a change in behavior, it immediately makes me start to not necessarily think negative things, but is there something else going on here that I need to at least pay attention to?
Thank you. We're about at the halfway point, so I just want to step in for a moment and remind our watchers and participants that you can ask questions using the chat box or the question and answer function down at the bottom, and then we will be able to respond to them. And reflecting on what people have said so far, we're definitely seeing the same kinds of things with the veteran population, that our clinic has seen an increase in requests for services in really kind of every area, in requests for children, for couples, for families, for individuals, both active duty and veterans and family members. And that veterans are particularly prone to issues with social isolation, even leaving aside the pandemic situation and the other stressors. But, having that layered on top has really exacerbated those other stressors that come along with it, the employment issues and life transitions and changes and things. That have made veterans particularly vulnerable to those challenges in this context. I'm wondering, Dr. Kern, what are the biggest struggles that you're seeing clients come to you with at this point in time? And what do you kind of make of that overall as what's happening for them?
Well, the sense of loss of control for a lot of people. A lot of us struggle with that just as human beings anyway. And one of the approaches that I use with people is to recognize where we can set healthy boundaries and expectations. In other words, yes, this is real. And I would like to piggyback on Commander Eversole's approach, because I applaud the fact that you're very open and honest with people about, and I have a model called acknowledge, assess, and address. So acknowledging that, yes, this has happened, and this is, in general, it's a problematic thing that's happened. It's a bad thing that's happened. Most of us wish it hadn't happened. And so for all of us to acknowledge that, yes, it has had an impact on everybody, and not to ignore that, not to act like, not to go into denial about it and act like everything's fine when it is not, because then we can't do anything about it. We cannot help people. We can't help ourselves if we deny that this pandemic has created a huge disruption in our lives. So that's the first thing, is helping people to acknowledge, yes, something out of our control, something that was unprecedented, unpredictable, and in many ways very disruptive and painful has happened. Because then that validates it for people. It helps them realize that they're not losing their minds, that what's happening, it's a sense of shared experience, and therefore that also helps with the isolation, believe it or not. They're not feeling so alienated, or it's a way to help them not internalize this experience as well. So to externalize the experience and to recognize that there are ways within this experience that perhaps they cannot actually control the experience itself, but what they do have power over is their behavior. In other words, to the extent that we know that there are many things we can do to increase our safety and to reduce the likelihood that we will contract this virus, that's one big thing right there. And also, again, even with a lot of the limitations that the pandemic and the quarantine have imposed upon us, really redefining, our sense of joy and meaning. And for a lot of people, that has steered them to looking at kind of their spirituality now. I mean, some of the more fundamental values in their lives, valuing the relationships, valuing their own lives, valuing what really matters, and being able to refocus on that. So, for instance, being grateful for the things in their lives that are still working well. Certainly, as Commander Eversole mentioned, losing a job is just really traumatic for people. Fortunately, most of two of my clients have lost jobs now that I think about it, but overall, most have not. And that can be a very disruptive experience. On top of this is a very this pandemic, as well as the other things going on, such as the racial injustice and the outrage about that, as well as a lot of the financial and economic crises. It's a compound effect for some people. And it is important that we recognize that we assess the impact on us, how we're doing in the face of it, that we find our power. I always say, don't give power to the circumstance. You maintain your power, recognize what you can and cannot control, and that is a way to feel much more in control within the circumstance. And then address it. If you need help, as has been mentioned by both Dr. Bodaghi, I'm sorry, and Commander Eversole, that yes, to recognize there's no shame or blame in seeking help, that to destigmatize this. This is real. It makes sense that this is hurtful to a lot of people. So fortunately, there are a lot of resources out there now that are addressing this.
Thank you so much. And I love that, the alliteration of acknowledge, address, assess. That's a wonderful, easy to remember sort of thing to go by. So a couple things. One, we'll have the results of the poll should be popping up, I believe, so we can take a look at live, sort of what people are reporting about their experience with, these things in the last 6 months. And we can see that many of us are reporting a lot of feeling anxious and worried. Nobody said never. So that's somewhat telling, but we see a lot of the often as being the most frequent response, feeling restless or agitated, and a lot of health concerns and social isolation as those big factors for people feeling stressed about the things that are happening. And thank you so much to everybody who took a minute or two to answer that survey. And speaking of resources, you're probably seeing things popping up in the chat box, numerous resources from our presenters, as well as a host of links of many of the resources that Easterseals has for veterans. We touched briefly on social isolation. We have an events page. Many are open to the public. Some are specific for veterans. And a couple resources from 2 apps that are put out by the VA for coping during the time of COVID. That's the Moving Forward app and the COVID Coach app, and they're wonderful with lots of resources in them. So we want to make sure that everybody gets a lot of things that they can take home and use for themselves when thinking about coping with this. And with these events. We also had a question, whoops, oh dear, a question that was submitted in the question and answer box, which was, and maybe I'll throw this out to Dr. Bodaghi, so we continue kind of rotating. Oh no, it went away. Sorry, I got it back. What are the trusted, how does somebody know what information they can trust in terms of figuring out information in the news, medical information, COVID or vaccine information? How would you suggest somebody sort of filter stuff to figure out and have some confidence about what they're learning or hearing about?
I have realized that reading too much and a vast number of things to be reading will give you different information at different places. So the direct source of where you can get the direct information, that's where I would say we should look. If we want to know the rates of the illness that it affects in our community, we need to directly go to CDC.com or and such, or just there are community type resources that are there to investigate. Anyone else have something to add to that? I would defer to Dr. Cohen, Commander Eversole.
I agree wholeheartedly with you, Dr. Bodaghi, because it is important that we go to the actual official resources as opposed to just what we read on Facebook, or not to malign Facebook, but in social media, I'll say that, or hearsay, because there, unfortunately, you're going to hear a wide range of opinions. And if they're from unofficial sources that do not have any kind of scientific basis, then we really should not trust those.
Yeah, I couldn't agree more. I think that going to the source, and I'm a recovering lawyer now, as everyone mentioned, but when I was practicing law, I worked for a great judge who said, "Look, I'm a smart guy, but I don't need, when you draft something for me, to put a bunch of adjectives and adverbs to describe a point that you're trying to make, because I can figure it out myself. I'm a pretty smart guy." And as I've grown as a person who runs an organization, and even the practice of law, I really try to avoid personally the use of adjectives and adverbs to describe something, but stick to the facts. And I expect the same thing from my news source. I read an article the other week where somebody was describing, part of the country that I won't name, says, well, we've had a slight decrease in the number of COVID cases over the last 6 weeks. And then I looked at the data, and it was a 50% drop. Now, I don't need someone to tell me it's slight when it's 50%, because at the end of the day, if I would have just looked at the article, I would say, oh, there's been a slight decrease. But when I looked at the actual data, my viewpoint on it was much different. And I think that, part of what we have to do to get past the sensationalization of a lot of the news is get back to the basics. Let's look at the facts, and we're all smart people, and let's make decisions on our own as to where we are with these things. And I think that's really important.
Thank you. That's so helpful. And I think keeping in mind that sensationalism is designed to hold you like your eyes on the screen, right? That comes from needing people to be watching for advertising income and things like that. And so it's really designed to to keep you there. And I'm sure we've all gone down the rabbit hole, like on the online or with the news before, you know, where you sit down at 7:30 and you start looking at stuff, and before you know it, it's 10 p.m. or something, and you've lost like your whole evening to nonsense online, basically. So really sort of, sometimes I'll even set a timer so that I know like I'm gonna stop, like in terms of practical implications. But so using reliable sources, and I see Abby put in the chat box a link to the CDC, and then, you know, having an antenna up for that sensationalistic kind of stuff that's designed to really suck you in and keep you. It's not a mistake. You know, they know what they're doing to keep you there and interested in that stuff. So Commander Eversole, maybe you could say some more about some of the programs that you're seeing employers or workplaces put in place specifically for workers to help with all the stuff that's happening right now and those stresses and overwhelm.
Well, it's a great question, and one that we were able to bring a great group of organizations like Easterseals and companies together to create a practical guide for wellness in the workplace. And that's available at hireourheroes.org/wellbeing. It talks a little bit about the work we're doing with organizations in the business community. And you know, what I would emphasize, and the guide's great, we try to keep it simple. It's not an encyclopedia of information. We tried to highlight what we think are some pretty good resources for businesses, but we really wanted to keep it, you know, from the business community perspective, not write the book on it, but simply help people start to navigate the process. I was concerned, quite honestly, when we wrote it. Big businesses that have the resources, they can hire consultants and really figure it out. I'm concerned about the small and medium-sized businesses where most Americans work anyway. And how do we, you know, take those small, medium-sized businesses and think about steps, positive steps that they can take that are going to make a meaningful difference in their employees' lives. And so some of those practical suggestions, you know, and kind of the book is really laid out across the pledges. How do we take steps to reduce stigma? How do we take steps to really assess and evaluate where our employees are, or help them get the resources? And what's really important here, I think, from a company perspective, and there's great, you know, we didn't need to reinvent the wheel here. There are great organizations doing good work in this space. From either a business perspective or from a nonprofit perspective. Mental Health First Aid Day is great work being done by the National Council on Behavioral Health. There's a lot of really positive stuff, but we wanted to open, especially that small and medium-sized business communities, lens to these programs and opportunities that don't necessarily cost a lot of money, but can make a meaningful difference. But again, you know, I think, and again, it's what I talked about you know, at the beginning of my discussion. You know, I really do think it starts with leadership at the top. You have to be willing to have conversations and understand where people are coming from if you really want to address some of the fears and challenges that they're facing. And there are times when I've had, you know, issues come up in the conversations over the last couple of months where I don't personally know exactly how the person feels because of my upbringing or background or gender or race, but I'm hopefully smart enough to figure out that you know, A, it's not made up, and B, you know, I have to, you know, find a meaningful way to help address that person's challenge. And I don't necessarily have to understand everything about what they're feeling, but I appreciate where they come from, and I need to value it and know that it makes my business and my organization better and help them find ways to address those challenges. So I do think that starts at leadership and, you know, a little bit of empathy and a lot of listening. I mean, that's from my viewpoint, probably one of the most important things that companies and leaders need to do is simply listen and learn and really, you know, not try to argue with everybody. You know, we don't let's, you know, in many instances there's no right or wrong answer. It's an answer, and we need to accept that and then try to help them navigate, you know, what's preventing them from, you know, maximizing their potential in your business. Because I can tell you, if they're personally feeling this, if they're, you know, if this is something that's weighing down their rucksack, it's impacting their performance in your business. So you need to address it and be smart about it.
Thank you. And Dr. Kern, could you speak a little bit about the happier and healthier you and how that sort of fits with what we're talking about today as well?
Well, my Happy and Healthy You program and the philosophy that generates the program, and by the way, the tagline is learn to love life and live well. So basically it is in the spirit of wellness. And so it was actually my clinical practice that informed the need to get on the proactive end of helping people understand what undergirds our well-being emotionally and how important that is to our overall functioning. And so the Happy and Healthy You presentations, workshops, writings that I do zero in on overall stress management and well-being in that sense, as well as in one's enhancing career life and happiness and success, as well as improving relationships with people. So in those kind of three areas of one's life. And it's important that we recognize that we do have power to help prevent a lot of the depression and the uncontrollable anxiety that oftentimes people are suffering from. So the more we can educate people about that and empower them with skills and strategies around embracing their life, embracing their power to be happy and healthy, and understanding, and there's a lot of resources out there to help us understand what those strategies are, then the better off we are.
Thank you so much. Yeah, the resources and responses right now and skills that somebody learns, maybe 5 years from now, they may unpack again the next time life throws them a curveball, right? It's wonderful to sort of see people, help people acquire those kinds of things. Dr. Bodaghi, are there some resources, you know, that parents could look to, or maybe things that are even directed for children, for elementary or middle school or high school age children, that you would point people towards for this sort of thing?
Of course, thank you. It's a wonderful question. Through DC MAP, pediatricians' offices have been empowered to seek out consultative resources from psychiatrists to provide children and adolescents attention if they need that extra resource or assessment. So the pediatrician is the first stop where you are concerned for your child to take them, and then through DC MAP, they can further resources can be found as well. Always, of course, chance, if you are worried, you can have them come and do an assessment on your kiddo, and just keeping the dialogue open as well with your kiddo. I want to stress that sometimes the kiddo may not speak, but you can ask their opinion through their friends. How is your friend dealing with this and this? And their thoughts will eventually reveal themselves as well. So that's my thoughts.
Mm-hmm. Are there particular, and of course it's been one of the challenges has been for families, right? Like everybody has maybe too much together time, you know, stuck at home. Are there particular types of activities that you would encourage, given the context, either at home or outside of the home, that you're seeing as being helpful for kind of having more positive interactions for children with their parents?
Of course. We as humans, people, kids, we thrive on routine and consistency. We thrive on that. And the only person that likes change is the wet baby. That's my joke, always. So having some kind of routine within the family, dinner time, being a routine that this is what we do, but family game night, family movie night, those are things that continue the positive relationships, encourages dialogue within the family and such. Board games have become really popular during COVID. So lots of family engaging board games. So much has been put aside before with busy lives, and now we have the time to be together again. And we can unpack these games and play them.
I know around like May or so, I was trying to buy a puzzle, and you could not get one because everybody had taken up that as a good indoor, activity to occupy time. So thank you so much.
And lots of crafting. Lots of crafting with the younger kids. Yeah. My goodness, those younger kids, just like kindergarten, they love their crafts.
And we have, as part of like our events through the Stephen A. Cohen Military Family Clinic at Easterseals, we actually have some art therapy and crafting events, and using like things that you would have at home, likely anyhow, like egg cartons and stuff. And it really is a wonderful way to sort of do something that you can do together with kids or individually, and you get to see some other people because it's done over Zoom, so you don't have that sense of isolation, or you get to have that sense of connection that Dr. Kern touched on, also that importance of feeling like you're not the only one in this, in going through this and in this moment. I know we have about 5 minutes left, and so I wanted to check in first and encourage our folks that are watching to enter any other questions they may have, and also to thank our panelists, and kind of to open the floor for last remarks and things that you want to say in closing as we get to the end of our hour. And for the sake of not overspeaking, I'll invite Dr. Kern to kind of wrap up, and then I'll work through the other folks.
Well, again, thank you very much for allowing me to participate in this wonderful forum. I feel very privileged to have been among such a wonderful group of esteemed and accomplished professionals and clinicians. So thank you very much. And I just want to encourage people to recognize that even though we may not be able to predict what's going to happen, what life is going to look like in a year from now, you're still here. Let's focus to the extent that we can focus on the present, be mindful of what's going on right now. We can reduce that anxiety about trying to predict something like the future, which we really cannot predict and fully control. So again, to just reinforce developing an optimistic, positive attitude, and one that is empowered around what it is you can do, and to focus on capturing your joy in any way you can, in a healthy way, of course, and to get creative. This is an opportunity to learn new things, to learn new ways, to find new traditions in a different way. And I've been very impressed with the resilience as well as the innovative spirit of human beings. So wishing you continued happiness and healthiness as you go on.
Thank you so much. Commander Eversole?
Well, I just want to first and foremost say how honored we are to be able to participate in today's discussion, and underscore how important it is to have this discussion on a national level to a national. I also want to just thank Easterseals for their leadership in this space. Easterseals, whether it's the Stephen A. and Alexander Cohen Military Family Clinic, or all the other work, you're really your boots on the ground when it comes to helping to lighten the load of not only our military families, but our families and communities across America. So thanks for your leadership on that front. It was a real honor to participate today.
Thank you. And Dr. Bodaghi?
Yes, it was an absolute joy and honor to be a participant and a panel member today. As a child and adolescent psychiatrist, and someone who has devoted herself to children and adolescent mental health, and finding ways to do it differently through tele, which was years ago, what, I'm not going to do that, to now it's everyone's way of life. we are resilient. We are able to find new ways to do things differently, and it could be done, and it's okay. The change could be okay. And to embrace that, like Dr. Kern said, change is going to happen, and we can accept it. We should talk about it. We should find ways to find solutions and together work through it, whether through resources in the community with each other. There are resources, there are supports. Just ask for help.
Thank you so much. Before we sign off, I just want to check in with John if you had any closing remarks before we end the presentation.
Well, Anika, I wanted to thank you for being a wonderful moderator and all of our wonderful panelists. You gave me some great ideas. I'm going to go out into the world being more mindful, making sure I find my joy, noticing others, and taking a break for self-care. And I hope others will take their own messages from today's great advice and panelists. So thank you all.
Thank you. Bye-bye.